Welcome to Muted in Medicine, the podcast where we break the silence on the untold stories and pressing issues within the healthcare profession. Join us as we dive deep into topics that often linger in the shadows of medical corridors and are not discussed in conferences, meetings, social gatherings, and in the hallways. They are often hiding. From navigating errors and facing litigation to the often overlooked realm of mental health among healthcare professionals. Through candid conversations and storytelling, we aim to amplify the voices and shed light on challenges that resonate across the medical landscape. So grab your stethoscope and a cup of coffee and tune in as we uncover the layers of complexity in the world of healthcare that are so muted yet so profoundly impactful.
Hello, everyone, and welcome to Muted in Medicine, the podcast where we break the silence around the untold stories of healthcare. My name is Saba Fatima, and I'm your host for this podcast. I'm a pediatrician with a passion for helping healthcare professionals facing secondary trauma at work in healthcare, which often they're unprepared to face. Today, we're diving into a question that has been echoing across hospitals, clinics, and medical schools alike. Why does thriving in a medical career feel harder than ever before? Physicians today are burning out faster, leaving clinical roles earlier, and feeling more disillusioned with a system that once inspired them. But what's behind this growing disconnect? Is it just the workload, or is there something deeper at play? A loss of autonomy, a shift in values, a culture that's changed faster than we've had time to process. We're seeing more and more colleagues leave clinical practice, question their path, or feel like the meaning they once found in this work is slipping away. To help us unpack this, I'm honored to be joined by Dr. Robert Wittler, Professor of Pediatrics and Infectious Disease at the University of Kansas School of Medicine, Wichita. Dr. Wittler brings a remarkable depth of experience, not only as a physician, but as a leader, teacher, and mentor. He served in the U.S. Army for 13 years, completing his pediatric residency at Letterman Army Medical Center in San Francisco, followed by a fellowship in pediatric infectious disease at Whitler Army Medical Center in Honolulu, and a research fellowship at Walter Reed Army Research Institute in Washington, D.C. Since 1995, Dr. Wittler has been on faculty at KU School of Medicine, Wichita, as the only pediatric infectious disease physician in Kansas. He's published widely in peer-reviewed journals and is a beloved educator, honored with numerous teaching awards, including the Chancellor's Distinguished Teaching Award and the Ruth Bohan Teaching Professorship. I'm extremely honored to have him on the show today. He brings both the wisdom of experience and a thoughtful curiosity about where we've been and where we're headed. Together, we'll reflect on the changing culture of medicine, the generational divide, the systemic forces behind burnout, and what we can still do to reclaim joy and meaning in this work. Dr. Wittler, welcome to the show.
Thank you. I'm glad you asked me to be here.
We ask everybody when we start the podcast, sort of a surprise question, but what's bringing you joy in medicine today?
What brings me joy in medicine today? Well, I think it's what's always brought me joy in medicine. I have this job where I get to interact with people like yourself, and that's part of it. But I love having medical students and residents and see how they grow and teaching. And honestly, they, I think, teach me more than I teach them. And it's an opportunity to kind of be a multiplier for how they interact with patients. And then there's a whole other science and interaction with patient part that I've realized has become, initially starting in medicine, it was about figuring out a diagnosis and being happy that you got that right. But honestly, I think it's more about how you interact with patients that is where the true joy comes from.
Yeah, that's awesome. And I think it's very important. I think teaching and connection with the patients are some of the things that a lot of people on the show, they talk about. I want to start by asking, what does thriving in a medical career mean to you? Because I feel like now I don't know if the term even stands anymore. What does that mean to you?
It means when I get up in the morning, I enjoy coming to work. I
Yeah.
mean, I like having time at home too, but I mean, it's a lot of days I'm excited about what's coming next. And so I enjoy working with my colleagues. Hopefully they enjoy working with me. And by the end of the day, I hope to have as much energy as when I started. And often that's the case. And really gain energy, in your interactions with patients and learners.
Yeah. And you've seen medicine, change so much over the decades. What feels different today about being a doctor or physician?
Well, I would say there's a huge amount of information that we can't memorize, or it's tough to get hold of all that compared to when I was in medical school. I think it was a bit simpler as I see residents and medical students. But even though the amount of information I think is so much greater, but we also have easier access to the information, and that's very helpful. I can do a PubMed search or even a Google search in a quick amount of time, because we don't always have the answers at the top of our head. Or I would say most of the time we don't. So when I get called by people or go see a patient, I mean, I'm often also looking things up at the same time and then trying to, but of course it's still, getting the whole story and then asking the right questions is the key.
Yeah. Does something feel different in like, not in a good way, which was better before and not better now?
Well, I think there are some things I wish we could go back to a bit more. For instance, I have clinic tomorrow morning, and I'll get referrals, and then they'll send records, and so I always feel like I have to look at that ahead of time. But often I may get a fax that has 100 pages because they just send the records for the kid's entire, he's 17, and I get stuff from when he was a newborn.
Yeah.
So I in the old days, I shouldn't say it that way, but previously a physician would call me and
Yeah.
tell me what the issue was, or send a letter. And I encourage that, and and sometimes I call them to try to figure out, because when you're looking through that much information, it's hard to know. Sometimes it's not clear what the question is.
Yeah.
And so I just think sometimes electronic medical records make more work than less work.
Yeah. Was there a time when in your career, I think, when you felt close to when you were burnt out or disconnected, and what kind of helped you come back to center?
Yeah, it's been some years ago, but there was a period of time when I thought our focus in the department was moving away from teaching and more having to do with things like RVUs or just the money part of it, the financial part, which you have to do. I understand that. But, I just felt like the thing that I truly enjoyed teaching, besides seeing patients, those are equal, that wasn't being valued as much as it had been.
Yeah.
And so that was the first time I ever really felt a bit alienated about work or being at work. And what got me through all that was mostly my wife, but somewhat also my kids, because she knew that things weren't right. And so she just said, well, maybe we need to look at a different job or and I started to do that, but then things kind of turned a corner and then turned around, and that issue got resolved. So, but yeah, it was, those days I felt exhausted after coming home. But thankfully my wife kept the focus, and there still were seeing patients, but yeah, I just thought the focus and what we were doing and why we're in an academic institution was getting lost.
Yeah. And how long ago was that?
Gosh, 15 years ago. So
15 years ago. Yeah. Yeah. And did you ever think about, like, were you disillusioned with medicine, you think, in general, or just because I feel like it has been a shift towards RVUs and everywhere across, the US.
Yeah, I think probably not long after I started here, I got a subpoena, a summons, about being named in a malpractice suit. And it was for one encounter where I was precepting the resident clinic at the time. So I was doing more, kind of started off doing some general pediatrics, and it was one visit to a senior resident. And I thought, gosh, what did I do here? And I just thought, this is how the system works. And I mean, and then those things take a lot of time. I mean, my name got dropped from it, but it still was the time it took and and I just, that was hard for me, but I saw another physician who it was very hard for. And basically he said, I'm going to quit. And I never thought I was going to quit, but it is a different, that's just happened to me that one time. And it was still it kind of shook you up to a great deal. But thankfully it's just the amount of time it took. To this day, I still don't, obviously I got dropped. So I think they finally ended up agreeing that it wasn't really, didn't have the relation to the case that was important. So, but you think you haven't done anything wrong, and then you get that. And of course, we all think we've done a lot of things wrong too, because you second guess all that too.
Yeah. And you were a new faculty, you said? You were new?
Yeah, I was new here. I mean, I'd only been here probably a couple of years.
Yeah.
And so it was one visit. It was a very complicated kid, but essentially they just, the plaintiff's lawyers just named everyone who was on the chart. Yeah. And then that's this process to get through. But it certainly took up a lot of my time and a lot of my thoughts too.
Yeah. And for a while, I think it changes the way you think about medicine and people. But then, yeah.
Yeah, I do a little bit of expert work and mostly for physicians. Well, pretty much exclusively for physicians. So it's an interesting system, and I see how it affects physicians, and I think it's often pretty sad because we tend to put a lot of blame on ourselves, and we're pretty hard on ourselves, and we think, what could I have done differently? I mean, that happens a lot.
Yeah. Yeah. When you talk to residents today or trainees today, how do you think your experience is different compared to theirs, like when you were training in residency? And residents are told these days to be tough and they need to be more resilient. And do you agree with that, or are they not tough enough?
No, I think they're plenty tough. I see them, and I mean, when I was a resident, honestly, it was even more to be tough, I think. I think the balance has gotten better over time. I think, there was no duty hours. We would be, I thought I was lucky as a pediatric resident being on call every third night rather than a surgery resident being on call at times every other night. And I'll never forget in San Francisco, at San Francisco General, you would often be busy around, if you were on call and you didn't make it to dinner, but they had a midnight meal. And I would see these poor surgery residents come in and their wife and kids would be there because that was the only time they saw their dad awake.
Oh, gosh. Yeah.
So I think that, I'm all for the duty hours and things. But again, I think medicine's different, just the amount of information and the complexities of electronic medical records and the administrative parts of it is still difficult for residents. But I also see a resident struggle at the start of residency, just trying because it's so much information at once, it's overwhelming. And then a few years later, they finish and they're confident and they're ready to go. And that was honestly the two best parts about being a residency program director, were seeing residents when they started and then when they graduate, and that growth that they had. So I think, as far as being resilient, it can be a difficult battle, and just like anything, there are people that struggle more than others. Others seem to get by pretty quickly. I think a lot of it is because they're focused, but also they don't blame themselves as much as some people do. So it's honestly, I think medicine is still an incredibly fulfilling job. It's a vocation. And when I have students or pre-med students ask me, what's it like to be a doctor? I hear stories about some doctors telling them, don't do it. It's not worth it.
Yeah.
Go to PA school, do something different. I've never said that to a student who's interested in medicine. I mean, they obviously need to think about it and see what's involved, but I highly encourage it. One of our 5 kids, and it was just one who wanted to be a physician, but I certainly didn't tell her to be a physician, nor did I tell her not to be.
And so you don't have any regrets?
No, I mean, not about, sometimes I think, gosh, should I have been an orthopedic surgeon? Should I have been something different in medicine, but never outside of medicine? And I always come back that I like what I do. I mean, it fits my personality. I think it fits,
Yeah.
how I think and how I interact with patients.
Yeah.
I mean, you know, I, I think that sometimes when I'm walking by and they have a Tesla or something out there, I'm going, rather than, I said, gosh, could we do this vacation instead of this vacation?
Yeah,
So,
that's when you think about it. Oh gosh, that's so funny. When you were talking about residency, when you saw like it was really tough, duty hour restrictions, and how did you think you thrived, or the people in that age thrived? I had a very good residency program, but I did hear like some comments from people, when they said like we did it all and it wasn't a big deal, and
yeah.
I heard that a lot. So it's hard for them to understand. But how did you do? Why do you think you did it?
Um, Honestly, I just love being a physician, and it was a passion, and I
Yeah.
thought it was the right call. I mean, I came from a family where there was no physicians. I was the 7th of 8 kids, and only one other of my siblings even went to college. So I didn't have a lot of role models, but somehow it all seemed to be the right answer. So it was one of the things I always felt I wanted to do, and getting in. So being a resident, it was a lot of work. It was tiring, but
Yeah.
and at that time I wasn't married. I didn't have kids, but I had a lot of good friends from residency. I was back in where I basically grew up, so
Right.
I had a lot of support in those ways, and plus I had family in the area, that my parents. That
Yeah.
was helpful.
Yeah. And did you do like a lot of like the 20 longer calls and more than 24 hours?
Oh, sure. You would be on, you would come in the morning, be on call all night. You work the next day.
Yeah. Oh, really?
Yeah.
Uh,
So, yeah, it wasn't. And again, we all did it then. I'm not saying it was easier or harder being a physician. Because again, I think there were some things that were simpler. I could jot my notes pretty quick. I
Yeah.
didn't have to go to a computer. I didn't have
Yeah.
to sign in. And there was a lot more. I think there's a lot of things we do better now, being more intentional about how we communicate and handoffs and those things. So I think we missed some things when I was younger that we don't miss now as much.
Yeah. So do you think the EMR is for the better or no? Like, what is your relationship with the EMR?
It's a love-hate relationship.
Yeah.
I It takes me longer to do notes, but I
Yeah.
think, and of course, I read my note again and I got, gosh, it did this and I wrote that, still there's corrections. You can't just go, but I think people could read it more than because my handwriting was not good,
Yeah.
um,
Yeah.
especially when you're going quick.
Yeah.
So I think, some of the boxes and things makes it easier to get. There are some shortcuts you could do with EMRs. Do I think it's made me a better physician? No.
Yeah.
I think it helps the hospital and billing and things. And I do think, sometimes it's easier to, I don't have to decipher someone's handwriting. That's the other part of it.
Yeah. And I think a lot of people do complain that we're spending less time with patients because of the EMR. So, do you think medicine has become like more transactional, less relational? And what has been your relationship with patients helped you over the years?
Well, hopefully more relational and less transactional. I think one of the things I like about is that I generally can take more time with patients than some specialties or primary care people do. I could schedule longer appointments. Not that it's always needed, but I always try to review all the records before I go into the room so I don't have to have them in front of me. And the thing that I can never do is have a laptop where I taking notes while I was in the room. I mean, that works for some people, but it just doesn't work for me.
Yeah.
Because I think, I never want to make a patient feel rushed, because that's the biggest complaint they have with physicians is that not listening to them. But honestly, so much of what you get when you talk to patients is how the expression on their face, their tone. Are they sad? Are they angry? There's a lot of emotional perceptions that you can get, and then you realize I have to go back and cover this again or take another route to get the answer here. I don't know I could do that if I was working on a laptop.
Yeah. Yeah. And you said you have the luxury to do that. I mean, do you think like primary care
Well,
physicians today have it or no?
well, I think, when they're scheduling a day, with appointment every 15 minutes, that,
Yeah.
I mean, obviously the complexity but they're going to have patients come in that they had 10 minutes with, and there's a significant problem.
Yeah.
And then they get behind, and then they don't go to lunch or whatever.
Yeah.
So that's why before I see the patient, I try to get as much information as possible
Yeah.
to be able, it's like when you're, on the floor when you have a new patient. I mean, that could be difficult.
And most doctors say like they would like more time with their patients. I think sometimes for me, like when I'm in the room, just a task list of what I have to do, like it tells me I may spend less time with the patient because it's just like I have to get through so many things. So
Oh, yeah. Yeah.
how do you deal with that?
Well, I have a task list, but I try to be fairly efficient. That's one of the benefits of being older is you kind of find ways to get things done quicker, I think, with time. I have the luxury of having seen a lot of patients over my career. And so it's not all from reading books and things. I certainly do try to keep up with literature and try to be evidence-based. But I think sometimes, compared to a junior resident or whatever, I could probably get through a history somewhat quicker.
Yeah, that's true.
And I don't, because I'm not asking a lot of those other questions that they feel they need to ask.
Yeah. And it's probably, I don't know if it's not, the medicine is not maybe difficult for you anymore, like the medicine part of it. Yeah.
Well, it's still always challenging. I mean, and honestly, that's intellectually stimulating too.
Right.
Because you're always sort of a detective in medicine and trying to find the answer.
Yeah.
And when you do, you feel pretty good about it. I mean, it's certainly also difficult when you don't find the answer.
Yeah.
And those are the hardest cases, especially if there's a bad outcome and no one had a really good answer for it.
Yeah.
Those are the ones that linger, I think.
Yeah. Yeah. What habits, mindsets have helped you stay grounded over the years? Is there something you do in your personal life or that helped you stay so fit and thriving?
Well, now I would say it's grandkids. It's different things over time.
Yeah.
I love sports. I'm a big sports fan.
Yeah.
So going to KU basketball games is still a lot of fun for me. But now it's even funner because I go with my kids or a friend.
Yeah.
My wife kind of put the kibosh on going. It's not her interest, but so we do other things. But and there's other things I enjoy, like photography and things, and it gets me an option to have a bit more creativity than some of the things I have to do at work.
Yeah. And yesterday I was talking to a group of residents and they were almost talking about all of them that they have left, like in residency, whatever used to bring them joy outside of work, and they've totally forgotten about it. But I think there are seasons, I guess, when you can get back to it. Like, would you agree?
Yeah. Yeah, I think so.
Yeah. How has you think your sense of purpose or changed or success, like your definition of success or purpose changed from when you started till now?
Well, I think when I started, success was figuring out a diagnosis,
Yeah.
um, and giving the right medication. But now, to me, success is more what I get back from the family and parents. To me, over time, it's being at the local grocery store. For us, it's Dillon's, and someone comes up to me and starts talking about their child that I saw 20 years ago or 15 years ago,
Yeah.
but it impacted them, and I feel, gosh, I thank them for that story that
Yeah.
in some maybe very small way helped them. That to me is the best part about this whole job.
Yeah. And what about, so you're academically, you did a lot of academic progression through the years. Like, what does that mean to you? Was that important, you think?
Well, I think the process was important about getting there. Yeah, I mean, it's one way you get, when you get recognized. I mean, we all want to be humble, but it still feels pretty good when you get recognized by your peers or students. And honestly, getting, like a teaching award from a student, to me, that's it. I mean, that's pretty, well, it's pretty humbling to me. Those kind of things certainly help you keep
Yeah.
going.
Yeah. Yeah. There's like a growing skepticism towards doctors. We see like a lot in COVID and with vaccines. And how do you feel about that? Was that something that was there before? Like, so much mistrust?
I think it's not as much. I think it's more COVID certainly accentuated some of that. I would say, from what I understand, physicians still are pretty held in fairly high regard by patients, but I think there is a bit more mistrust. I mean, gosh, we've just had a large measles outbreak in Kansas, and the last case of measles I saw was 2017, and that was a girl who was unimmunized, went to Romania for a mission trip and came back with measles. And even then, I'd gone many years, and the same thing happened in the late 80s with people. There was a lot about pertussis vaccine, but that extended to other vaccines, and people weren't getting immunized. I'm old enough that, well, I mean, back in that time, there was a nurse who died from measles. I mean,
Yeah.
I've seen people die from vaccine preventable diseases, so it's sad. It's hard, but when these things happen, yeah, I certainly think COVID was a learning experience. I hope we learn a lot from it. I do believe there is a greater mistrust, and sometimes that could take a long time to reverse.
Yeah. Yeah. And you saw measles, you said, in 2017?
Yeah, but that's so I went several years, so that's, what is
Yeah.
this, 8 years, because people were getting them, and that was a case of going to a place where there was endemic measles
Yeah.
and coming back. But before, I mean, when I was in Korea, I saw kids with measles.
Yeah.
I've certainly seen kids die from pertussis, die from meningitis. I think it's great, you know, that we don't see near as much of some of these things, meningitis and other things, as we used to. I mean, gosh, I remember HIV as a resident, and it was basically, there wasn't, for me in pediatrics, it was mostly kids who, like, hemophiliacs or had been transfusion, and there was so little we could offer and do. But that's obviously changed dramatically. So that's a huge victory in medicine.
Mhm. And was vaccine skepticism still there, like before, earlier?
Yeah, I think, I mean, well, I've been through, the pertussis thing. There was a TV personality who was very anti-vaccine, which spread. So there was multiple outbreaks. I've been through the MMR thing with autism from Dr. Wakefield,
Yeah.
and how that impacted people.
Yeah.
And honestly, still does. I had a group of students. I talked to every group of students, and part of it is going over different peds ID stuff, but also talking about vaccines. And
Yeah.
I tell them they all need to come to a decision about the risks and benefits. But if they feel the benefits are greater than the risks, which the vast majority do, then that's what you need to tell parents. There's some people I'm never going to convince.
Yeah.
That are very adamantly opposed, unless something happens. Like now, there's a measles outbreak, then they get vaccinated. Or like that family I said from 2017, there was a lot of siblings, they were unimmunized till she got measles.
Yeah.
Benjamin Franklin was against, like vaccinia until his son died from smallpox. And he then became a proponent of immunization. That goes way back, obviously, before I even knew him.
Yeah. Interesting. And you have such a good relationship with most families. How do you, like, when you approach this topic, is that tough? Like when you're talking about vaccines, or how do you do that? You have to be gentle.
Well, usually I try to see what their question is or what their concern is.
Yeah.
I mean, there's people that are adamantly opposed to vaccines, and I'm not likely to change their mind.
Yeah.
But there's also people that are just more hesitant. And in those, I think figuring out what their concerns are and trying to address that in a not always necessarily a scientific way, but also just, I could tell people, I mean, we have 5 kids and now I have grandkids that,
Right.
all our kids got immunized. And usually people think, gosh, he doesn't want to hurt his own kids. I hope they think that.
Yeah.
So, and again, I'm old enough to have experience kids dying from H flu, or pertussis, or,
Yeah.
well, even, I had actually never seen any children die from measles, but obviously in developing countries that happens.
Right.
But there was a nurse who died from measles that I knew of.
Yeah. Do you think the current healthcare system that you're in now or in the past, does it prioritize like the wellness of physicians, or it's more focused on like efficiency and cost cutting?
Well, I think it's more focused on wellness than what it had been years ago. Yeah, but there still is also cost cutting in those things. That
Yeah.
kind of, so it's a balance. It's hard to, I think we do a pretty good job with residents compared to previously.
Yeah.
As far as wellness goes. I don't have no one yet has a magical answer. And obviously, it depends upon the individual. But we're a small program, and I think that's a benefit is when someone's not doing well, they can sometimes be easier to spot and
Yeah.
to try to address.
What advice would you give to like younger physicians, or even people who are overwhelmed, or they kind of want to quit? Maybe they're thinking about quitting. What would you say?
Well, I would ask them to think back why they ever chose medicine.
Yeah.
And what was the whole point of it and what fulfills them. And then you have to let them know that none of us are perfect.
Yeah.
We make mistakes. And I think it's hard for physicians sometimes to ask for help. I know when I needed help in the past, I didn't always ask for it, but I learned that's, asking for help. Well, I think this for me, there's some of the best wisdom I can give residents is people is from a book called The Boy, the Mole, the Fox, and the Hound, because that whoever wrote that is an incredibly brilliant person.
Yeah.
And like in part of the book, that says, asking for help isn't giving up. It's staying in the fight, working to get help. So,
Is that
I
from the
think
book? Can you tell us more? Because we have listeners outside of Kansas too. Can you tell us more about that book and what you were going to say?
Sure. Well, so it's a book. It's called The Boy, the Mole, the Fox, and the Hound. And it's written by someone from England who had some mental health issues himself. And he started doing cartoons, and people said, "Oh gosh, you've helped me so much." And so he put it all in a book. And, last year the residents asked me to speak at graduation. And I mostly read passages from that book, honestly.
Yeah.
There's also a movie. It won an Academy Award for the best animated short. I would highly recommend all
Yeah.
physicians, and not just physicians. To me, that's just the wisdom that this person has. And I mentioned before, we're not perfect, but we're the best person we can be. So I think there's a lot of wisdom in that book. You can read it in a very brief period of time, but I think you'll be impacted by it.
Yeah. And you said asking for help. Could you repeat that? What was that line?
Oh yeah, I think I'm trying to remember exactly. It said, well, it's the horse and the boy, what's the hardest thing you've ever done? And he said, asking for help. But asking for help isn't giving up. It's staying in the fight. It's moving on. It's continuing to find an answer.
Yeah.
There's a lot, and it's just like, I think kindness is an underappreciated attribute, and kindness towards patients gets recognized. Patients don't always, years from now, don't necessarily remember what you told them, but they remember how you told them and how you made them feel.
Yeah. Yeah. That's amazing wisdom, I think. What do you think when you look back is like were some of the life-changing moments in your career? Can you think of anything like it changed the way who you are today?
Well, I mean, obviously getting married, having kids, but from a work perspective, and I talked about that, the story slam thing, when a patient dies and this struggle, do I go to a funeral? Do I go to the service? But honestly, I think that's one of the most relevant things I learned early on is the family appreciates that because, when I think a lot of times we get told you need to maintain distance with families. And that's true. I mean, there's things obviously boundaries you don't cross, but it doesn't mean you can't say, see them in a store and converse with them or say hello. So, yeah, I think that understanding that the patients there's a lot more behind a patient and a family than we'll ever know from our inner, there's a lot of battles going on that people have, and they don't necessarily let you know those unless you listen and
Yeah.
can have some interaction with them to be personal.
Yeah. So if you could go talk to a leadership at a hospital or were in charge, what was one thing you think you would change today?
What would I change? That's a great question. Well, I think, that it's not an adversarial relationship between hospital administration and physicians, hopefully.
Yeah.
I
Yeah.
think they need to, I think they could do a better job we all can do a better job of, getting more physician input and how you interact with patients. It seems like it always comes down to some health survey or something.
Yeah.
But I think, very, and, a Likert scale doesn't address everything that you need to understand what it takes. And the other thing with hospital administration, I would say, is that, and this is going to may not sound right, but I think they tend to be more near-term focused rather than long-term.
Yeah.
I know they're under immense pressure that they're from their higher ups and even, shareholders, if it's a for-profit, to make money. That's the bottom line. Unfortunately, I think they could maybe make more money if patients felt better about the care they got.
Yeah. Is that what you mean when you think they're like near-term focused?
I think, examples, I mean, we obviously in our department, we've been trying to increase resident complement for years.
Yeah.
It took a lot of time.
Yeah.
And it took a lot of convincing, but it needed to happen.
Yeah.
So, and I was very happy when it happened. I would have liked it to happen sooner, but it did happen. So it worked. We got there, and we'll see how it goes now.
Yeah. Yeah. If you could go back and talk to yourself as like a new attending or new resident, what would you tell yourself?
That I'm in pediatrics. I don't always have to be incredibly serious. I could have a little fun.
Yeah.
I could talk to kids. I could play with kids a little bit.
Yeah.
That's the beauty, I think, part of that's what really one of the things that drove me towards pediatrics. And that we're going to make mistakes and it's going to be hard and
Yeah.
you're not going to like yourself for making a mistake.
Yeah.
But again, I think I have to accept my limitations, but I also want to, strive to foster my strengths in a meaningful way.
Yeah.
So
I love that. Yeah. Were you always a serious person, like throughout?
I think many people thought I was pretty serious. I
Yeah.
mean, I I'll never forget as a third year resident hearing from another resident that a first year resident thought I was intimidating. And I thought, gosh, I've never thought I was intimidating.
Yeah.
So I had to rethink that whole thing and address how I think I spoke with her and other things in a different way.
Yeah. Do you think you thrived in your career?
I think I have. I personally feel satisfaction from what I've done. I see now people that were students with me 20 years ago
Yeah.
and doing incredible things. So, I feel like I also feel that I was a pretty good dad and husband. So those things mean a lot
Yeah.
to me.
Yeah. Yeah. That's awesome. I definitely think you have thrived, and I think we're so grateful to have you here. And some of the things I heard was, just it's okay to make mistakes. And talking to patients helps. I think listening to their story helps. I think that's the most important part of what you've done. Um, and I guess be kinder to yourself. What gives you hope for the future of medicine and in general what you're doing? Are you feeling hopeful or no?
Yeah, I think I've always been an optimist. I feel hopeful.
Yeah,
Again, I've seen so many wonderful things, including vaccines, I think are wonderful things. But,
yeah,
I mentioned HIV. I just think and I see kids who used to die from cancer that are
yeah,
doing well now. And gosh, that's amazing.
yeah,
I think and it continues to be amazing.
yeah. Is there anything that you wanted to say today that you haven't said yet today?
I think I probably already said too much, but um, I just appreciate you letting me. Yeah, I appreciate your questions and the way you go about it. So, and I love what you've done in the department with the story slam and those things. And yeah, it's been great.
Thank you so much. No, this was so wonderful. I think it will be so wonderful for anyone to listen, even in Kansas and outside. And I think it's just a great example of something that I aspire to, to be like you. I don't know if I've
Oh,
told you.
uh,
I don't know if I can ever get there, but I'll try.
oh no, you'll get there and go beyond. I mean, I have to admit that now I'm getting at the end of my career and I look forward to what happens, but I don't know I could ever truly entirely dissociate myself from medicine.
Right.
I would still like to teach and do other things. And
Yeah.
so I'm still working full time,
Yeah.
but,
Yeah.
but there will be a point then.
Yeah.
Yeah. So
Do you feel sad about that? Do you feel sad about that? Yeah.
I think there's parts of it that make me feel sad, but I know my wife has plans for me. So that's
Are you gonna travel a lot? Yeah.
Yeah, we've done more travel, and I think we'll do more then. Because I
Yeah.
used to, honestly, I think this is something. I guess when you ask about regrets, I probably regret that I felt like I always had to be here,
Yeah.
that I couldn't ever leave. Because I think there are times when I think we could have done some more travel. It wasn't until we were, later that I felt more open about doing that. But so I probably no one is irreplaceable.
Yeah.
So I still try to do whatever I can to help other physicians or patients. But yeah, I think I probably felt I was too important before when I wasn't.
You felt too committed to, and you thought the patients would suffer like that. And that's, I think, common, right?
Yeah.
Yeah. Is that what you felt? Yeah.
Well, I felt like I'm the only Peds ID person. So,
Yeah.
it was hard to, if we went, maybe I wasn't going to go as long or those kind of things. So, I mean, honestly, I think I was wrong about all that. But I mean, I've mended my ways, I think.
Yeah, you have. You are very important though. I hope we never made you feel less important. Um as we close today's episode, it's a tradition on the podcast that we end it with a poem. I'm reminded of a poem. It's by Douglas Malloch and it's called Good Timber. It speaks to what it means to grow strong, not in the absence of struggle, but because of it. And I think, Dr. Wittler, your journey is a reminder of that, that sometimes strength, it doesn't come from ease, but from endurance and, profession.
Yeah, you're right.
Yeah,
No, that's true. Yeah.
In this profession, I think we need those roots more than ever. And today's conversation was just a great reminder of that.
Yeah.
So
I think those struggles make you stronger. If you don't ever have that, you're not going to flourish.
Yeah. So I'll read the poem. It's called Good Timber, the tree that never had to fight for sun and sky and air and light, but stood out in the open plain and always got its share of rain. Never became a forest king, but lived and died a scrubby thing. The man who never had to toil to gain and farm his patch of soil, who never had to win his share of sun and sky and light and air, never became a manly man, but lived and died as he began. Good timber does not grow with ease. The stronger wind, the stronger trees. The farther sky, the greater length. The more the storm, the more the strength. By sun and cold, by rain and snow, in trees and men, good timbers grow. Where thickest lies the forest growth, we find the patriarchs of both. And they hold counsel with the stars, whose broken branches show the scars of many winds and much of strife. This is the common law of life. Thank you, Dr. Wittler, for being with us today.
Oh, no, thank you for that poem. That's beautiful.
Yeah.
I think you should tell all the new residents that poem.
Yeah, thank you so much for being with us today.